Hello there. I am here at the American Society of Plastic Surgeons annual meeting at National Harbor in Oxon Hill, Maryland. I happen to find one of the few dermatologists in the exhibit hall, Dr. Rebecca Fitzgerald of Los Angeles, California. How are you?
I'm doing well. Thank you very much.
Well, thank you for joining us.
More than welcome.
We're here to talk about really changes in the global approach to facial fillers and the aging face. Can you tell me what advances have you seen in the last few years?
Yeah, I can. I think one of the biggest advances is that what we used to do was try and sort of fix a fold or a line. People would come in and say, oh, you know, I don't like this and I don't like these, and look at this new fold and look at what's happening here. And I think that what we've learned over the last several years is that these lines and folds are the culmination of years of an underlying sort of global process, and I think that being at a surgical meeting, a great deal of the surgical literature that's come out over the last several years is sort of a testimony to that.
I attended a very interesting session this morning on the jowls and facial rejuvenation, and one thing that a plastic surgeon was saying was that he looks at the aging face as not so much an up-down process, but as an in and out process. And have you found that in the patients that you treat in your private practice?
Yeah, that's a very good question, actually. You know, one of the best analogies that I can give you is if you think of a vase of long-stemmed French tulips sitting on a counter on Monday, and you look at the same vase on Friday, all the flowers that were once sort of doing this just sort of tump over and hit the counter, right? And gravity hasn't changed at all from Monday to Friday. But the hydration state of the flowers, and therefore their vulnerability to gravity, has changed a great deal. So as all of those structural tissue layers in terms of the craniofacial support, the fat, the muscle, and the skin change, we deflate like a balloon. And as we deflate, we become much more susceptible to gravity. So what happens to those flowers in over, say, a period of 8 days sort of happens to us very slowly over a period of 8 decades.
So, Dr. Fitzgerald, what do you do when you have a patient who comes into the office and they say, I just want this one line or this one fold fixed?
I think that it's incumbent upon us to sort of help educate the patients that that fold or line is not living in a void, that the face is a very complex, interlocking, three-dimensional puzzle, and that fold or line is part of that puzzle, and that if you fix just that one piece without attention to the whole three-dimensional puzzle, then they may be disappointed with the results.
Dr. Fitzgerald, thank you for talking with Skin and Allergy News, and before we let you go, just wanted to know if you had any disclosures relevant to our discussion on facial rejuvenation.
Yeah, sure. I speak and train for a number of the different filler companies, including Allergan, Bioform, Mertz, and Sanofi.
Okay, well, thank you for joining us.